Hello, this is Dr. Kavian for Virginia Medical Updates. Today I want to address the issue of acne. Acne obviously has been an issue for a long time for youth, teenagers, and sometimes into adulthood. Acne is just basically not a mere kind of insignificant cosmetological issue. People do obsess about acne as teenagers, as older adults, and especially if these acne become scarring, they could be very debilitating and very difficult. Thankfully nowadays there are a lot of different medications and treatment modalities for acne, and I will be talking about a few of these right now, which I think are very beneficial. Acne is a pretty simple treatment, really, if one thinks about this in a very logical manner. So if the pores on the skin are closed, basically, then the resultant from acne is the white comedones. If the pores are open and the material gets oxidized, then it's the black comedones. So if you look at these small bumps with a little crater and blackness in the middle of it. And these two types of acne respond really well to any kind of retin-A, and it does help any kind of retinol to basically open up the skin, exfoliate, and basically create new layers of skin and getting rid of the old skin. This way the pores open up, new skin comes out, old skin goes away. The medications are minimally worrisome in terms of redness, peeling, and otherwise they work really well. And there are different gels and creams, and the gels are a little bit stronger, the creams are a little bit weaker, and there are different brands. I just like to use the generic retin-A personally in my office, but there are other brands that can also be used, and there are also a number of combination products that could be used. Again, the simpler the better, I think, and that works really well. With that, and if the patient is having cystic acne that basically is corynebacteria or other bacteria, then I think the best thing is the use of minocycline or doxycycline. With that, in general, doxycycline has been studied a little in studies and have been shown to be a little more superior to minocycline. Even though minocycline is easier, I use a lot of minocycline, but in terms of side effects, then I think doxycycline is actually probably a better medication with less side effects. Obviously, people that are pregnant cannot be on the medication, and it cannot be used in children that are below the age of 8. Otherwise, the medication is very, very effective and very good, and it does have, the class of tetracyclines have a kind of a solid anti-inflammation effect, and that by itself also allows the medication to become a lot more effective, and that's very nice. And also it can prevent scarring in the form of acne. In acne that's a little more severe and is scarring, and you could see that in people. You want to really prevent this, and definitely at that point I recommend referral to dermatology, and the use of Accutane is really very useful, and Accutane is very beneficial. It can basically create a complete halting in the kind of acne. You can dry the acne up pretty well, and then people can actually really not scar. So the downside, of course, with the Accutane is that you have to make sure they're not pregnant. So there's a pregnancy test beforehand for girls, and then there's definitely kind of dual method of control because it's highly teratogenic, causes birth defects at a very high rate. Also, I want to go back and say retin-A also is a topical form of the same formulation they apply on the skin. That basically should not be used in ladies that could be potentially be pregnant. So having said that, then I think that Accutane is a very, very good medication for treatment of scarring, acne. It has amazing results. It's done by dermatologists for the most part, and there are some requirements. There has to be kind of a CBC level checked, cholesterol level checked. The pregnancy test has to be done so people cannot be pregnant, and also the medication is sometimes expensive, but I think that in general it's a very beneficial and good way of treating the scarring acne, which can really scar the face and cause kind of a disfiguring or unhappy look for kind of for a long time. So it's a good investment, but they're prescribed by dermatologists, and then basically there has to be liver enzyme checked every so often for these things. This is Dr. Kavian for Virginia Medical Updates. See you at the next episode. Thank you and have a good day.